Hi there, my name's Tyler Jefferson. I'm a physician assistant and I work with Dr. Carruthers. We want to take care of you after your surgery. We also have some things that we want to remind you of before your surgery. 10 days before your surgery, we want you to stop medications that might interfere with your bleeding. That includes medications like ibuprofen, Aleve, or aspirin, as well as glucosamine, fish oil, and turmeric. If you take any prescribed blood thinner medications, make sure you talk to us about those medications ahead of time so we can safely stop them before your surgery. You will receive a phone call the day before your surgery from the hospital. They will let you know what time we'd like you to arrive at the hospital. Please don't have anything to eat or drink after midnight the night before the surgery. When you arrive at the hospital on the day of surgery, we will move you into the preoperative waiting area. At this point, you will have a discussion with your anesthesia provider regarding the type of anesthesia you will receive. There are a few different types of anesthesia, and the details of that will be ironed out with your anesthesia provider. Next, we will move you into the operating room, at which time your surgery will be performed. Dr. Carruthers discussed the details of that surgery already. After the surgery, you get transferred to the recovery room. Most patients end up going home the same day of the surgery. Some patients spend one night in the hospital. While you're in the recovery room, a physical therapist will work with you. The physical therapist is going to work with you on safely getting in and out of bed and on and off the toilet. Once you go home from the hospital, it's very important to continue with your physical therapy. There's a couple of options on how that can happen. One is we can have a physical therapist out to your home to work with you. Secondarily, somebody can drive you to a physical therapy clinic where you work on your therapy exercises. Either way, we'll make a plan ahead of time. We give you some medications after the surgery to help in pain control. We will discuss those medicines with you in detail before the surgery. Most patients, we just give baby aspirin twice a day. Other patients need a stronger blood thinner to help prevent blood clots. That decision is made between you and I at your pre-op visit. You will have a dressing over your incision. That dressing is something called Prineo. Prineo is a substance that's kind of like a mesh tape, and it needs to stay on for the first 2 weeks after the surgery. If you have a knee replacement, there will be a bulky dressing over the top of the Prineo. Either way, the Prineo can get damp in the shower after the surgery. We don't like it to get soaking wet though. So if you do have a knee replacement, you might want to cover it with some saran wrap or just prevent the stream of water from running over the incision area. The Prineo needs to be removed 2 weeks after the surgery. Just like a Band-Aid, you peel it right off the skin. About a month after the surgery, you come back into the office to visit with me. We will take some x-rays, evaluate your incision, see how you're progressing with physical therapy, and then make a plan for your continued care. We do see you at intervals after the surgery, approximately 3 months, and then every 3 to 5 years. Those visits will be with either Dr. Carruthers or myself. Thanks again for trusting us with your care, and we look forward to helping you get back to activity.